My name is Riyad Ismagilov, and I am the head of the Center for Modern Implantation. And in this video, I will tell you what to do with an uncomfortable removable denture. Very often patients come to our clinic with the issue of the removable denture rubbing, an uncomfortable removable denture, or the denture slipping. What should I do? Help me. Watch this video until the end, and you'll find out how to solve this problem. First, and one of the most important things is getting used to it. That is, of course, habit adaptation, or getting used to a removable denture is very important. Since this is a huge and popular item in our clinic, we call such patients, of course, heroes, because walking with a huge and popular item in the Republic of Tatarstan is extremely difficult. You also need to chew, talk, laugh, and lead some kind of full life with this. So the moment of adaptation and getting used to it is very important. It's very important, so the denture, especially in the first few months, should be worn without taking it off, even at night, only removing it for cleaning and putting it back on. And then the adaptation process will be much faster, and the person will get used to it because it is a removable prosthesis. In fact, it's a pretty good and proper alternative when there are no teeth at all, so getting used to it plays a key role, and that's very important. I emphasize the need to adapt and get used to this denture, treating it like your own natural teeth. Yes, it's not easy, but the main point is adapting to walking and talking. It's very, very important to speak out loud. Maybe it's about reading poetry, perhaps singing songs and talking more often. That's the only way to get used to it. And of course, I emphasize that in the first few months, it's very important not to take it off, only removing it for cleaning, and to wear it. So adaptation is one of the key elements for successfully getting used to and eventually using this denture. The second problem is the rubbing of the denture, or something is getting in the way, which usually requires some adjustments to the denture. The orthopedic doctor will correct problem areas right in the chair in front of you, and most often this is visible to everyone. At the same time, we always ask patients not to remove the removable denture at least a few hours before the appointment, so that the doctor can see the problematic areas. Under no circumstances should you bring the denture in your hands and say, "This is bothering me, what should I do?" It's quite difficult for the doctor to see the problem area, so it's essential to wear the removable denture, walk around for at least half a day without taking it off, and then come to the doctor. Of course, you have to endure a bit, but coming to the doctor this way ensures that they can immediately see those problematic spots and make the necessary adjustments. And sometimes that's enough. For the most part, that's enough. So this kind of adjustment is when the doctor simply smooths out any protruding areas or sharp, uncomfortable spots. And that's usually enough to prevent it from rubbing. Third moment. If it's not enough, if the denture is sinking in, it can also cause rubbing. There's also a solution to this problem known as peri-base. What it is that the doctor most often takes your removable denture and adds more material, more plastic to certain areas, or he increases it. So this is usually the case. This is related to taking a new impression, absolutely. And on your existing denture, the doctor adds a certain amount of material or even reduces it in some areas. We get, let's say, your new denture but slightly updated, and most often that's also enough to prevent the denture from sinking. So it's about rebasing. And of course, a very important fundamental and key point is the experience of the doctor or the dental technician, because removable dentures are still, despite modern technologies, despite the fact that now a huge number of very modern high precision impression materials, however, this is a very complex type of prosthetics, and from the dental technician and from the orthopedic doctor, the most important thing requires a lot of attention and professionalism. Above all, this is very important. So the doctor's experience definitely affects the creation and further use of your dentures. So if something doesn't work out, you can definitely ask the doctor to take the impression again. Redo this protest again. Even in our clinic, this has happened when a patient really struggles to get used to it. we'll redo the dentures, make them from scratch, take new impressions and create a new prosthesis, and the problem is resolved in the same way, and the patient walks around comfortably with the removable prosthesis. A very important point, fundamentally just as important. As for the attitude towards removable dentures, now in modern realities, for some reason, there became some kind of dismissive attitude that this is something very antediluvian and outdated. Perhaps that's partly true, but in reality at this moment, solving the problem of toothless jaws, or complete edentulism, as we call it when there are no teeth at all, we have almost no alternatives, but there are only two. So it's either implants or this kind of removable prosthesis. So we absolutely cannot write it off. A removable prosthesis is a good, complete solution to the problem. Patients live with removable dentures, they live fully, chew and enjoy life. Here, I want to emphasize that the factors we've pointed out are very important. That's why it deepens your understanding. This type of prosthetic is reliable, still exists, and will continue to exist for many more years. Nothing better has been invented yet, because not everyone has the means for implants. Implant surgery is certainly expensive, so this is a real solution to the problems. So if you don't have any teeth, don't put it off, don't look at other people, and most importantly, focus on your dentures that you already have. There are also a lot of such patients, the article says, in our clinic, miles in mono, in my experience. There are a lot of patients who, after getting their dentures, put them away in a drawer, saying they can't get used to them or don't want to. So take them out, get used to them, adapt, and make adjustments. Because even the standards state that removable dentures require certain corrections. This is absolutely normal. So of course, the professionalism of the doctor plays a huge role in prosthetics. And there are doctors who practically don't make any adjustments, meaning the prosthesis is handed over, as they say, from day one, and the patient just leaves. But nevertheless, adjustments to the prosthesis, it's absolutely normal practice. A removable prosthesis is a completely valid, real solution to the problem. So under no circumstances should you put it off. And if you have this problem and you really don't understand how to live fully, and most importantly, chew with your teeth, then get removable dentures. Reach out to the right clinics. Get to the right doctors. Everything will be fine. If you've tried all these things and still can't get used to the removable denture, you only have one alternative. This is not removable prosthetics on implants. Most often we talk about the so-called technology, all on 4 or all on 6. There is only one alternative. So don't expect miracles, and you need to clearly understand either a removable denture or a fixed denture on implant. There is no other option when you have a complete absence of teeth. Subscribe to our channel so you don't miss the video about implantation in cases of complete tooth loss.